All right. So thank you everyone for joining us today. Welcome to the Pathways to Wellness Access and Care webinar series. The Health Council of West Central Florida designed this series with the goal of addressing knowledge gaps for all individuals, regardless of health insurance status. And today's webinar will feature a presentation on federally qualified health centers, specifically focusing on a local FQHC, Central Florida Healthcare. I do want to note that the chat box will be disabled during the presentation, and then towards the end, we will bring it back up for any questions. So a disclaimer about our series: the views and opinions expressed in this webinar are solely those of presenters and not necessarily reflect the official policy or position of the Health Council of West Central Florida. The information in our webinars and e-materials, digital recordings, and other materials like our resource list is for general information and educational purposes only and should not be construed as an endorsement, recommendation, or promotion of any specific person, company, product, or service. Nothing contained in these materials is or is intended to be construed as advice. We are only providing you with techniques, tools, information, insights, and educational material to assist you in your personal life and navigation of accessing care and/or health insurance. And so today's speaker, we have Sherry Pratt from Central Florida Healthcare. She is a media and communications specialist. She has over 15 years experience in news anchoring and reporting, and transitioning out of that field, she started working in communication roles for local organizations, including Polk County Sheriff's Office before her time at Central Florida Healthcare. So she'll kind of share a little bit about her FQHC, and we will hand it over to Sherry. I'll stop sharing now.
Good morning, everyone. Thank you so much for having me. I'm so excited to be a part of this webinar this morning. I'm going to make my screen a little bigger. And yes, so I am with Central Florida Healthcare, and we are healthcare with a heart.
Oh,
and
Sherry,
I simply
we
love
can't
can you
see
see
the presentation. No.
Can you see it?
No.
Okay. Hold on one second.
That's okay.
Okay, hi. Can you see it now?
Yes.
Okay, wonderful. Okay, let me just make it a little larger.
If you just hit the slideshow button, that should bring us along a little bit over, a little bit further.
Let's see.
Slideshow. Yep, right. Oh, right there.
There it
There
is.
you go.
I couldn't see. There was something covering it up.
And then play from start. There you go.
There we go. All right, wonderful. Okay. So to begin with our first slide. Okay, so what is a federally qualified health center? Well, we specialize with primary healthcare centers serving patients who have limited and or restricted access to care, affordable, high quality, comprehensive primary care, medically underserved populations, regardless of their insurance status or ability to pay for services. And there's a safety net provider. No one is turned away. And that is one thing that makes us so special and so unique. The difference between us and a rural health clinic is federally qualified health centers can operate both in rural and non-rural areas with medical shortages. FQHCs qualify for reimbursements from Medicaid and Medicare and are required to provide care for patients in all life cycles. So that's one thing that makes us unique. Some of our health resources and services administration, HRSA, it provides funding to FQHCs under Section 330 of the Public Health Service Act. Health centers are given a service area or a catchment area to provide primary healthcare services. Okay, so FQHCs in the US, there are 1,400 community health centers, 53 right here in Florida, serving 30 million patients. That is a lot of patients. 9 million children, 1.5 million homeless, and 400,000 veterans. So FQHCs make a tremendous difference in the United States. Some of the quality reporting requirements include, reporting the diabetes, HbA1c. We just hired our first specialists who specializes with diabetes. We focus on reporting hypertension control, low birth weight, cervical breast colorectal cancer screening, sealants for 6 to 9-year-olds. We have a mobile unit that goes out and they do a lot of sealants, depression screening, tobacco screening, and childhood immunizations. And just a little detail, there is a 2023 Federal Tort Claim Act deemed status, provides malpractice insurance, allows money that would have been spent on malpractice insurance to go back into the community, rigorous annual application to prove the health center has safeguards in place to minimize the risk. So a little bit about us. Central Florida Healthcare was founded in 1972, right in Frostproof, Florida, in which we're very excited to announce we have a new health center being built there as I'm speaking, and we'll have a brand new facility, hopefully by the beginning of next year. So we're excited about that. Our service areas are Polk, Highlands, and Hardee counties, and we have a 15-member board of directors who are actually meeting with our senior team this morning. And they are very passionate in helping us. So as I mentioned, we were founded in 1972 in Frostproof. We expanded to Hardee County in 1975. We have a beautiful new facility in Wauchula. We expanded to Highlands County in 1980, We have a beautiful facility, Avon Park. And then currently we have 15 health centers and 3 mobile units. And CFHC has grown from 8 health centers in 2014 to 15 health centers, 3 mobile units. As I mentioned, we have 2 warehouses and 2 administrative buildings. And I will say a lot of this growth is due to our CEO, Ann Clausen, who just is an amazing person with such a focused vision. She's really helped with our expansion. And we are growing. We actually have 535 employees. We just hired a few the other day, so that number is growing. We have physicians, nurse practitioners, dentists, dental hygienists, pharmacists, pharmacy techs, psychologists, just numerous employees. We have a nutritionist. We have an optometrist, RNs, LPNs. A lot of people don't realize that we are a one-stop shop. It's not just medical. We have, of course, dental, optometry. We have nutrition, behavioral health. We now have our new endocrinologist focused on diabetes. So as you see, we have a lot of different services we provide and so much staff or so many people to help help our patients every day. We have a lot of people and we just are continuing to grow. Okay, so in 2022, 2023, as you can see, we saw 70,711 patients, over 227,000 visits, and over 600,000 call center calls. So, and that number is just increasing for the next fiscal year for us to report the data. We are Joint Commission accredited. This is something we're very proud of, and we should be receiving another visit from the commission in 2025. And as I mentioned, we have so many different services: medical, dental, behavioral health, OBGYN, optometry, lab, x-ray, pharmacy. Most of our health centers have a pharmacy, and this is such a blessing. I was going to briefly touch on, we have a 340B program, which allows us to be able to make prescriptions much lower for our patients. So it's very affordable for patients to get prescriptions. They can see the doc and they can leave with their prescription. So it's such a godsend. We also have navigators. If you've never heard of a navigator, they're similar to a social worker. Some patients will go and they will meet with navigators and they will just see how they can qualify for certain programs within the county. A lot of our navigators are bilingual, so they're able to, speak a number of languages to help people who are in need of assistance. Okay, so we also are very involved with residency programs. We talk to a lot of students. We have a lot of students who intern with us. We work very closely with Baycare, Advent Health, LECOM, dental residency program, and as you can see, school partnerships for internships and clinical rotations. Our partners, we love our partners. The United Way is a huge supporter of us. Heartland for Children, Central Florida Healthcare is just so excited to partner with like Southeastern and the Polk County School Board. And just to let you know, one of our 15 health centers is actually at Crystal Lake Elementary School in Lakeland. It's a community partnership school. And so our clinic is not only used by the children who attend the school, but also to families and pretty much anyone in the community. And what makes this so great is there is a huge community around the school. So a lot of these families, if they're having trouble with transportation, they can just walk over to our clinic and they can see one of our providers. They can have a checkup. They could be scheduled to go to even other CFHC locations. So it's such a valuable tool. We are also part of Ending Hunger. It's one of our best programs here. We have 10 food distribution sites. As you can see, almost 1 in 5 families are food insecure. So in 2020, during the pandemic, we realized that there was a need for more food distributions. So we started a partnership with the United Way, with the George Jenkins Foundation. We also receive food from Feeding Tampa Bay and the Freedom Tour. And in 2022, we distributed over 800,000 pounds of food, and we served over 39,000 families, including over 50,000 children. And that number is also growing. We usually give food to over 100 families at every distribution site. And there's usually a couple distribution sites each week. And here's our payor mix. As you can see, our largest number, 54%, is Medicaid. Of course, we also take Medicare, other third-party insurances, and we also see the uninsured. We do have something that is called it's like a sliding fee scale. And so patients can present their income, and then we can help lower the cost of what the appointment's going to be. So that's also such a benefit. I'd mentioned we are in Highlands County. This is our beautiful Wauchula Community Health Center. It was recently built. It's, I want to say, almost 2 years old. And on the far right, there is a drive-through pharmacy. And we have new health centers planned, and a lot of them will have the drive-through pharmacy, which is wonderful. But Wauchula offers medical and dental, pediatrics, OBGYN. It just provides a number of services. This is our new Davenport Community Health Center. It just turned a year old in August, and we're actually expanding with this building. Now upstairs, we share that with another office, but we are going to be expanding a little further out to the right. But we have a pharmacy here. We also have medical, dental, OBGYN, pediatrics, and this is where our endocrinologist is, who is our diabetes specialist. So this is her home base, and she's helped so many people since she's come on board this year in 2022. And this is the exciting Frostproof Community Health Center that we have that will open hopefully in January 2023. It's a beautiful facility. It will have the drive-through pharmacy. This health center is very special to the residents of Frostproof. As I mentioned earlier, this is where we started in 1972, and it's located downtown Frostproof. So a lot of people are very excited about the expansion here. Exciting future news to announce. We are going to be eventually tearing down our current Lakeland Community Health Center and putting this beautiful facility in its place. And what's great about this facility is, so in Lakeland, we have Lakeland Pediatrics in a separate facility. We have our Lakeland Hills Dental in a separate facility. And then we have our Lakeland Primary. And so all three of those facilities will be combined into this one facility. And this will also have a diabetes center of excellence. And we will have a big nutrition area too, where people can make appointments and have some help with their nutrition advice. So we're excited. This is another exciting announcement. This will be our future community or Winter Haven Community Health Center. And this is where the administrative offices will be. We also have a primary facility, and we also have behavioral health, and we have the Magnolia Center, which is women and children's and pediatrics. So a lot of those centers are also going to be combined into this one center. And that's going to be on First Street South. So we're very excited about that expansion. Okay, some of the challenges and legislative issues, meeting the needs of the community. So many people need us, and that's why we are growing. That's why these facilities need to expand, is because we're running out of space. And so by growing and expanding, it's only going to help us, answer the call for help from more people. Workforce and staffing, that's why we work so closely with the local schools, trying to find, people ready to work and live and then stay in Polk and Highlands and Hardy counties. So if you know anyone looking for a position, please send them our way. Pharmacy and providing credentialing. That I don't know a lot on to touch on. We have an amazing director of pharmacy, McPicos, who just has done a phenomenal job, but he's working to always improve our pharmacy. And funding for health centers. That's always a challenge, is funding for many things across the country right now. And then our 340B and our contract pharmacy program. This program is so important. And so we're always talking to our legislators about the importance of this program and just keeping it going each year. So that's really it. We just provide so much for the community. And if you know anyone who's in need of any of these services, please feel free to direct them our way. So does anyone have any questions?
Sherry, I have a few thoughts or a few questions. So if an individual is uninsured and they wanted to make an appointment to come in to the clinic, what kind of paperwork and documentation would they need to bring with them? How does that process work? If somebody
Right. Well, they would first of all just call our call center, and then our call center would probably refer them to one of our navigators. And basically you would just, if you do have a job, you would submit your last pay stub, and then, show your driver's license. And then I think you may have to show your social security card, but I'm not 100% sure about that. But our navigators can definitely answer any question anyone has. They just need to basically start by calling the call center and saying, hey, I'd like an appointment. How can I proceed forward? Great.
I think one of the things that was really important when you talked about both as an issue for manpower, but development of having large enough workforce, but are people who go to work for federally qualified health centers eligible for federal loan forgivenesses? Is that one of the areas where people can get those kinds of things?
That's a very good question. I would definitely have to ask one of our leaders about that. I don't know that specifically, but if anybody is interested in coming to work for us, those questions can easily be answered.
Sure.
But that's a very good question.
Yeah. So with the community partnership schools, you had indicated that some of that was just open to the general community, so they don't necessarily have to have children enrolled in the school, or do they? Is it?
No,
It's
no. The good thing about it being there is so a lot of the children can tell their families, hey, there's a doctor's office right on campus, and we send out newsletters to the families. But yes, we always try to spread the word that, hey, if you live in the area, you're welcome to come to Central Florida Healthcare. We're always trying to spread that awareness. So yes, it's open to the public, to anybody.
That's great. So are any of your facilities open in the evening or on a Saturday, or is it still pretty much?
Yes.
So it's
You
even better hours than your average doctor.
Well, it depends. Excuse me, some of our health centers are from 8 to 5. A few will open early, like at 7:30. Usually they close at 5, but we are open. Some of our centers, I know Lakeland is open on Saturdays, I believe Avon Park. And we also take walk-ins. So let's say you're really sick and you call the call center and there's like, well, there's no appointments. You can go and you can walk in and say, listen, I'm just really sick. I need to see a doctor. And then sometimes we offer telehealth as well. So if you're an established patient, you can even do a telehealth call, which is very convenient. If, let's say, you went to the doctor and 4 days later, you're just still sick and you just can't get out of bed, that's a wonderful resource for sure.
Great. Any questions from the participants? Do we have any
I did
questions you
open
can
up
type
the
into the
chat.
Q&A?
I don't see any yet.
Okay. Well, I just want to reiterate what a valuable resource community health centers are, federally qualified health centers. You'll hear them referred to both ways. Really can get a full range of services. It doesn't matter whether you have insurance or not. And I personally get my primary care from a community health center, and I have insurance, and it's really good quality care. So I would be
Definitely.
first one to support that. And the involvement in the community and looking beyond just health and realizing how much things like access to food matter. And especially with I love your diabetes initiative, because diabetes is one of the main chronic diseases everywhere, but certainly within the Tri-County area in which you're providing services. And it sounds like that having an epidemiologist now, or I'm sorry, endocrinologist
Yes,
now,
yes.
would really be making a big difference for your patients there. And the nutrition programs is really comprehensive. It's not just going to your doctor and then going home and being forgotten about. You can refer within your own network, so your medical records are transferred easily from one provider to another, and just a very comprehensive range of services. So I
And
am
a
a
couple, I
go
just
ahead.
wanted to stop you too. There's a couple, I just realized there's 2 things I wanted to mention real quick as well. I'd mentioned briefly, we do have a mobile unit. We have 3 mobile units. And I will tell you, this mobile unit is always going out in the community. And it's going to areas where, some people can't leave their residence, especially a lot of senior living, the senior living resident where people can go and they can just go to the mobile unit and get their treatment. So I did want to mention we do have that. And then also behavioral health. We have a new behavioral health location here in downtown Winter Haven. And this has been a blessing because there's such a need for behavioral health in Polk County, especially. And we've seen just an increase in patients. And some patients can go and they can actually see a nurse practitioner and they could see a psychologist during the same visit. And a lot of times, too, our mobile unit will go to Lakeland and offer behavioral health services. So that is an extreme blessing. We kind of consider ourselves sometimes a one-stop shop because, yeah, you can knock everything out. Maybe you don't want to do it in one day, but you can go and you can be like, all right, I'm getting my medical appointment today. While I'm here, I'd love to schedule for my dental appointment. And then, yes, I'd love even a behavioral health appointment too. So There's so many different resources that we can provide and just make things a little bit more convenient for people.
Sure. Pick up your pick up your meds right at the same time. I mean,
Yes.
that's very convenient for
It's
everybody.
very
So
convenient. And we also mail and deliver medications as well if that's needed.
that's great.
Mhm.
That's terrific. So they can, obviously, if they're on an insurance program, would you then you would take insurance, or you would have the 340B plan,
Right.
depending on what.
You know, if they do not have a job, that's no problem. I mean, we're not going to turn anyone away, and we have the availability to be able to still prescribe and still get people in, which is such a godsend. But yes, if you have insurance, insurance will, that'll take care of everything as well. So it's such a benefit for everyone. I'm a patient myself. I love Central Florida Healthcare. I take my children to our pediatrics office in Lakeland. Our providers are just the entire staff, the providers, the staff, everybody is kind, very willing to help you. It's just an amazing place, amazing place. And I'm not just saying that because I work there. It truly is.
No, no. And depending on where you live, there are community health centers all over the state of Florida.
Right.
I'm going to see if I can enter. There is a Florida Association that that has. Let me see if I can put the link in here.
Yeah.
Yeah, there we go. So there is a Florida Association. So if you are not in the Hardy Highlands or Polk County area, you can go to that website and it will show you the variety of community health centers that are available in every county that has one. And some of them are specialized. Some are may just be specifically for behavioral health, and some are all encompassing. Some counties will have more than one community health center, not meaning one facility, but more than one provider who may have multiple facilities. So you've got lots of options available, and I really strongly recommend the work that they do, and think that it's a really great resource, particularly because they are located in areas where access to care is a problem. So that's all there to help fill that gap. Any other questions? Let's see if anything else came in. Don't see anything else at the moment. Well, I do thank you for your time, Sherry, and I thank all of our participants for being here today. We will be sending out slides from the show, from the show, from this webinar today, and we have our next one coming up on January 26th, which is kid care and how covering kids and families. So we'll be focusing just on that. If you have children or know people who have children who are interested in getting care for them, this will be one you don't want to miss. And then on March 8th, we'll be discussing a little bit more about uninsured people. We have 3 county indigent healthcare programs that we'll be presenting. We have free clinic, mobile clinic, as well as a specialty care provider as well that can be helping for people that are not insured at all. And so we invite you to join us for that. Your Grubhub vouchers will be sent directly from Advent Health after this is over. So please watch your email for that. And we look forward to seeing you, and we thank Advent for their support with this. And please tell your friends about all the upcoming events. Anyone like to add anything else?
Thank you so much for having me today. I really appreciate it. And thank you for letting me share about Central Florida Healthcare.
Thank you for being on. We appreciate everybody attending. Have a great rest of your Friday.
Bye.